that roughly 8 in 10 of the uninsured, those who come through the doors of this medical center, come from working families. Most are middle class, and families earning between $25,000 and $75,000 a year are the fastest growing group of the uninsured. We all know that younger adults ages 25 to 34 and older adults ages 45 to 64 are the most susceptible to losing insurance coverage, indicating that it's hard to obtain coverage when you first start out in the world of work and harder to maintain it as you age and experience health problems. Finally, employer-sponsored health insurance is on the decline. In 2007, 60% of employers offered health benefits, down from 69% 6 years ago. This is at a time when people are changing jobs more frequently than ever before. Many Americans are now self-employed, running businesses out of their homes, and they struggle to buy health insurance. My plan takes all of these realities into account and addresses them head-on. And this plan isn't just my plan. It's the product of hundreds of discussions with thousands of people and hospitals and union halls, homes and businesses across America. And going forward in this campaign and then as president, I'm going to keep reaching out, asking for ideas, not just in improving and enacting the plan, but in the daily work to make it a reality. Now, here's how this plan would work. If you have private insurance you like, nothing changes. You can keep that insurance. If you like the doctor you have, you can keep seeing that doctor. If you like the hospital where you receive care, you can keep receiving care at that hospital. If, however, you don't have health insurance, or you don't like the insurance you have, you can choose from the same wide variety of private plans that members of Congress choose from. I'm calling it a health choices menu. So essentially, the Congressional Health Care Plan becomes the American Health Care Plan. The idea here is simple. The American people should have access to the same array of health care choices and benefits as the senators and representatives they elect. You will also have as one of those choices a public plan, just like Medicare is a public plan. You will have access to a public plan that will provide a stable, competitive alternative to private insurance if that is your choice. My plan does not create a single new government department, agency, or bureaucracy. It is not a government takeover of health care. It is a public-private partnership that provides more choices. If you're an employer, you choose whichever plan is best for your business. If you're an individual, you choose whichever plan is best for you and your family. And we will provide tax credits to ensure you can pay for it. Now, whether you keep the insurance you have or you choose one of the options in the Health Choices menu, you will have the following guarantees. First, you will never be denied coverage because of pre-existing conditions or risk factors. Insurance companies will no longer be allowed to discriminate against high-risk patients or charge exorbitant premiums to screen them out. So whether you were sick in the past or a genetic test shows you may get sick in the future, you'll never again have to worry about finding affordable coverage. Second, your coverage will be guaranteed. If you pay your premiums and follow the rules, your insurance company will be required to renew your coverage each year at a price you can afford. Even if you lose your job, even if you decide to start your own business or stay home with your children for a few years. Third, your coverage will be affordable. My plan provides tax credits to make health care both universal and affordable for everyone. These new tax credits guarantee that you'll never pay more than a certain percentage of your income for your premiums. No more worrying that one illness or one accident will lead to financial ruin. Fourth, you will always have an option for coverage that is fully portable. I will require insurance companies in the Health Choices menu to let you take your plan with you as you move from job to job or even state to state. Now, exactly how will all of this be possible? Well, it's going to take shared responsibility. Everyone with a stake in our healthcare system will have to step forward and do their part. While I will be requiring all Americans to have health care, I will be calling on employers to do their part as well. Today, large American companies compete in a global economy against companies in countries that impose far lower health care burdens on employers. And many of our manufacturers are struggling to pay for retiree health commitments that our foreign competitors simply don't have. Under my plan, large companies will be required to help pay for their employees' health care. Those that do so can simply maintain their current policies if they choose. Those that don't will need to contribute toward the cost of covering their employees on a sliding scale based on their size and average wages. My plan also helps American manufacturers become more competitive by providing a tax credit to those struggling with the high costs of retiree health benefits. These costs are making it virtually impossible for American manufacturers to compete with their foreign counterparts who don't have these kinds of costs. How can we possibly compete if a car company like General Motors pays $1,635 in healthcare costs per car produced, while Toyota is only paying $215 per car? And think about the retirees who rely on these benefits today, people who accepted lower wages over the years in return for the promise of a secure retirement. The tax credit I provide will help employers cover catastrophic costs above a certain threshold, costs incurred by a few retirees with the most severe health problems, costs that can run hundreds of thousands of dollars for a single person. This relief will be a temporary measure designed to address the needs of aging baby boomers. And it will be available not just to qualifying private sector manufacturers, but to states to help pay retiree costs for teachers, police officers, firefighters, and others. In return for this assistance, companies will have to modernize their plans with initiative to cut waste and improve quality. And they will have to show that they're using the tax credits to enhance their competitiveness and support their workers. We also know that healthcare costs are plaguing too many of our small businesses. That's a serious problem because small businesses are now the engine of job creation in America. According to the Federal Reserve, since 1990, companies with fewer than 20 employees were responsible for 80% of the additional new jobs in America, jobs that often cannot be outsourced. But at the same time, small businesses face higher premiums because of their limited purchasing power, and they tend to employ lower income workers. As a result, they cover far fewer of their employees, and that coverage is eroding. Since 2000, the percentage of small businesses offering benefits has fallen from 57% to 45%. Now, under my plan, we will not require small businesses to cover employees. Instead, we will provide tax credits to ensure that many of them do. These tax credits will be based on size and average wages, so that small businesses can provide health care without destroying their bottom line. This credit could be as high as 50% of premiums for firms with fewer than 25 employees. It's a good start that small businesses are leading the way in creating jobs. My goal is for them to create new jobs with good health care benefits as well. Government also needs to do its part to promote shared responsibility. Under my plan, the government will provide tax credits to ensure that every single American can afford health insurance. The government will also invest in measures to improve health care quality and cut costs. This will result in dramatic savings, which I will use to continue to make health care